New tonight, this week is the 30th anniversary of National Public Health Week. Tonight, our Megan Marshall talks with health administrators about how they take climate action to build healthy communities. She joins us now in the studio. Megan.
The 30th anniversary of National Public Health Week kicked off Monday. Every year, the first full week of April is a time to recognize public health contributions and address key health issues. The American Public Health Association organizes the week around 5 key health issues. Tonight, we will hear from the NPHW and nearby health departments about the second key issue on climate action.
The first full week of April is National Public Health Week. It was made official in 1995 by an executive order from President Clinton, according to Susan Poland with the American Public Health Association. The organization names 5 new key health issues every year. The second key health issue for 2025 is climate action.
Climate change is an existential threat, and it is something that people are experiencing the impact of right now in this time. And so it is an important issue to continue to raise up and to have people understand the implications of the change in climate on their day-to-day life.
On the NPHW website, one of the ways to take climate action is staying prepared. Malcolm Lanham serves as the Community Health and Threat Preparedness Director at the Mid-Ohio Valley Health Department, and he says the agency makes it their goal to keep the community prepared.
My team's mission statement is a healthy community is a prepared community. We've seen an uptick of natural disasters. So within our threat preparedness, we're going to be doing more community preparedness related courses.
Jack Pepper, the administrator for the Athens Health Department, says it has 2 departments that deal with climate action.
One of them, of course, is our emergency response department. How we're going to respond in particular to public health issues, but also how we can be a support mechanism in the event of a natural disaster. And the other one that comes to mind is we do have a fairly robust vector disease control program.
When it comes to post-natural disaster aid, the Meigs County Health Department steps up anywhere it can.
Sent staff before to help with different cleanup efforts. We do have a mobile hospital that we can deploy, if needed to assist. While we're not necessarily first responders to emergencies, we find that we do get requests, for assistance, and we just try to step up in any way our resources are available to help.
Restaurants and businesses on Front Street in Marietta were impacted by the floods in April of 2024. Part of climate action, according to Kelly Miller with the Marietta Belpre Health Department, is working with restaurants to make them safe again for the public.
I'm out there at the restaurants, getting them inspected and opened back up once they've been cleaned and such, so that they can get open for business. We try not to keep them, don't want them shut down for long as possible. But we want everybody to be safe and get back up and running.
Reporting from Parkersburg, this is Megan Marshall. WTAP News, this is home.
You can read more about how climate action impacts public health at WTAP.com. We will take a look at the final 3 key health issues over the next 3 days. Back to you.